This podcast is sponsored by Talkspace. You know when you're really stressed or not feeling so great about your life or about yourself? Talking to someone who understands can really help. But who is that person? How do you find them? Where do you even start? Talkspace. Talkspace makes it easy to get the support you need. With Talkspace, you can go online, answer a few questions about your preferences, and be matched with a therapist. And because you'll meet your therapist online, you don't have to take time off work or arrange childcare. You'll meet on your schedule, wherever you feel most at ease. If you're depressed, stressed, struggling with a relationship, or if you want some counseling for you and your partner, or just need a little extra one-on-one support, Talkspace is here for you. Plus, Talkspace works with most major insurers, and most insured members have a $0 copay. No insurance? No problem. Now get $80 off of your first month with promo code SPACE80 when you go to Talkspace.com. Match with a licensed therapist today at Talkspace.com. Save $80 with code SPACE80 at Talkspace.com.
How schizotypal personality disorder differs from schizophrenia. Schizotypal personality disorder, STPD, and schizophrenia share some similarities, such as odd thinking and unusual perceptions, but they are distinct conditions with key differences. While both conditions fall under the category of psychotic disorders, STPD is a personality disorder, and schizophrenia is a severe psychotic disorder. In this article, we will explore the key differences between schizotypal personality disorder and schizophrenia, focusing on the symptoms, diagnosis, and treatment approaches for each. 1. Nature of the disorder. Schizotypal personality disorder is considered a personality disorder, which means it involves long-standing patterns of behavior and thinking that deviate significantly from societal expectations. These patterns are usually present from a young age and persist across various situations. Schizophrenia, on the other hand, is a severe psychotic disorder characterized by episodes of psychosis, including hallucinations, delusions, and disorganized thinking. Schizophrenia often involves periods of acute symptoms, during which an individual may lose touch with reality. 2. Symptoms and severity. While both STPD and schizophrenia involve unusual thoughts or perceptions, the severity and impact of these symptoms differ significantly. Schizotypal personality disorder symptoms are generally milder and more eccentric. Individuals with STPD may experience magical thinking, odd beliefs, or unusual speech, but these symptoms do not reach the level of full-blown delusions or hallucinations as seen in schizophrenia. Schizophrenia typically involves more severe and psychotic symptoms, such as delusions, false beliefs, hallucinations, hearing or seeing things that aren't real, and significant disorganized thinking that severely impairs the ability to function. 3. Cognitive and functional impact. People with schizotypal personality disorder may have eccentric thinking and difficulty forming relationships, but they generally maintain some level of functionality. They are often able to manage daily tasks and responsibilities, although they may struggle with social interactions and emotional connections. In contrast, individuals with schizophrenia experience severe cognitive dysfunction and a significant decline in functional abilities. Schizophrenia can impair an individual's ability to work, maintain relationships, and care for themselves, especially during active episodes. 4. Duration and onset. Schizotypal personality disorder typically begins in adolescence or early adulthood and is a lifelong condition. Symptoms are more consistent over time, with individuals maintaining relatively stable eccentricities in thinking and behavior. Schizophrenia typically has an acute onset in late adolescence or early adulthood, often following a period of psychological deterioration. Episodes of psychosis are often interspersed with periods of stability, although cognitive deficits may persist. 5. Treatment approaches. Schizotypal personality disorder is primarily treated with psychotherapy, particularly cognitive behavioral therapy, CBT, which helps individuals address their irrational thoughts, improve social skills, and manage anxiety. Medication may be used to treat co-occurring conditions such as depression or anxiety. Schizophrenia, being a more severe condition, typically requires antipsychotic medications to control delusions and hallucinations. Therapy and rehabilitation can help with coping strategies, but the primary treatment for schizophrenia is pharmacological. Key insight: while schizotypal personality disorder shares some symptoms with schizophrenia, It is a less severe condition with milder symptoms and less disruption to daily life. The key differences lie in the severity of psychotic symptoms, the functional impact, and the treatment approaches used for each disorder.